A groundbreaking discovery by Cambridge doctors could revolutionize the treatment of Crohn's disease, offering a glimmer of hope to patients and a significant financial relief for the NHS. The research, conducted by experts from Addenbrooke's Hospital and the University of Cambridge, has unveiled a potentially game-changing approach to managing Crohn's. By employing biologic drugs such as Infliximab early on in the treatment process, rather than waiting for symptoms to worsen, they found a 5-fold increase in the effectiveness of controlling the disease. This top-down treatment method not only improves patient outcomes but also carries significant economic benefits. A recent analysis estimates that this approach could reduce the cost of care by a staggering £10,000 per patient over a 5-year period. Isobel Wright, a resident of Suffolk, shares her story, highlighting how her life could have taken a different turn had these treatments been available when she was first diagnosed as a teenager. Crohn's disease, a condition characterized by inflammation of the digestive tract, can severely impact an individual's quality of life, causing symptoms such as stomach pain, diarrhea, weight loss, and fatigue. Traditionally, it has been treated with a step-up approach, starting with milder drugs and progressing to more advanced therapies like Infliximab. However, the PROFILE trial, which followed 386 newly diagnosed Crohn's patients, compared the typical treatment approach with a new strategy of administering Infliximab immediately. The results were remarkable. Patients who received early, effective therapy reported higher quality of life scores, reduced reliance on steroid medication, and experienced fewer serious infections and hospitalizations. Professor Miles Parks, who led the trial, emphasized that these findings mark a pivotal moment in the management of Crohn's disease. With approximately 190,000 people in the UK living with the disease and 10,000 new diagnoses annually, the early treatment method could save the NHS up to £20 million each year, according to the Cambridge University Hospital's NHS Foundation Trust, CUH. CUH is now calling for an update to national reimbursement guidelines to promote the widespread adoption of this treatment. Isobel Wright, now 44, from Haverhill in Suffolk, knows all too well the impact of Crohn's disease. After being diagnosed as a teenager, she spent years in and out of hospital, even undergoing urgent surgery in 2008 due to a bowel perforation caused by the disease. It was a challenging period, marked by debilitating symptoms that affected her mental health, work, and social life. However, when she was prescribed Infliximab, she experienced a miraculous turnaround. Today, she visits the hospital every 8 weeks for treatment, and reflects on how her life could have been vastly different had these treatments been available earlier. Marianne Radcliffe, chief executive of Crohn's and Colitis UK, which supported the study, emphasized the importance of having access to safe and effective drugs that not only improve patient outcomes but also save the NHS money. Dr. Nuru Noor, the first author on the PROFILE trial paper, further emphasized that starting an effective treatment from diagnosis is not only more effective and safer but also more cost-effective than historical approaches. This research presents a promising development in the field of Crohn's disease management, offering a ray of hope for patients and a much-needed financial respite for the NHS. But here's where it gets controversial: should the NHS prioritize cost-saving measures over traditional treatment approaches? And what about the potential long-term effects of these biologic drugs? These are questions that warrant further discussion and exploration. What are your thoughts on this potential paradigm shift in Crohn's disease treatment? Do you think the NHS should adopt this new approach? Share your insights and opinions in the comments below.